Alright guys, so this is part 2. I'm going to continue reading the essay that I wrote and continue on with my birth plan. We just left off with the use of instrumental devices and a couple of actual real life stories where those negatively affected the baby and the families. So, the injuries caused by the use of these particular medical devices, forceps or vacuum devices, are not only fatal but in some cases can be lifelong. The mother may also suffer lacerations such as tearing around the vagina, which is the perineum, rectum, or the urethra. The perineum is the skin between the vagina and the rectum that oftentimes will tear even without the use of instruments, strictly due to the mother not appropriately pushing because of the epidural. In fact, an epidural actually doubles the mom's risk of vaginal tears. In order to prevent this tearing, some doctors will offer to perform an episiotomy, which is what I mentioned earlier, which is a surgical cut at the opening of the vagina that is stitched back up after birth. When all other methods have failed, a C-section is performed as last resort. A C-section is the delivery of a baby through a surgical incision in the mom's abdomen. And I know that that's kind of like, oh, well, it's common sense, you know, but a lot of women don't know. So I'm going to tell you. So yes, a C-section is the delivery of a baby through a surgical incision in the mom's abdomen. In the U.S., almost 1 out of 3 women will deliver their baby this way. That's a lot. American women give birth via C-section at more than double the rate that the World Health Organization recommends. What's more shocking is that some C-sections are planned for the sole purpose of the mom either not wanting to be pregnant anymore or her wanting the birth to accommodate her social schedule instead of allowing the baby in her body to make the call. And normally, you can't choose just to have a C-section unless you're like a celebrity and you can just schedule it, you know, whatever. Or your doctor gives you the option as far if it's like high risk or whatever. Medical interventions have become the number one reason a C-section is inevitable due to medical necessity, which means that everything that the doctors do, such as the epidural, the Pitocin, all of the instruments like the forceps, the vacuum devices, the episiotomy, those are all the number one reason why a C-section becomes a medical necessity. And I'll explain. The administered drugs, the epidural and the Pitocin, cause the baby to experience a respiratory depression, an increased heart rate variability, and a compromised blood supply at birth due to reduced blood pressure in the mom, all the while causing fetal malpositioning and ultimately resulting in fetal distress requiring immediate delivery. So how many of you guys have been in birth for hours and hours and hours, have been on Pitocin, you've been induced, you've been on Pitocin, you've had an epidural, and it's just not going anywhere, and suddenly, oh my gosh, the baby's in distress after, what, like 20 hours or more of active labor, and they say, well, you're going to need a C-section now. We just allowed you to go through pain for all that time, and now you're going to need a C-section because the baby's in distress. Big surprise there. However, in some cases where the mother and or baby are in danger due to natural health problems, no interventions, a C-section is medically necessary because the risk of the baby staying in exceeds the risk of induction. So C-sections are not terrible. I'm not putting moms that have had C-sections down because sometimes it is medically necessary. It's not like it's medically necessary from the beginning, not just because, like, obviously it becomes medically necessary when the baby's in distress, but what you guys need to realize is all of these things that you do during the childbirth process will put the baby in distress. So in order to avoid a C-section, you just want to avoid all of this altogether. Today, doctors are much more likely than in the past to turn to a C-section for breech babies, twins, and cases of lengthy labors. So if you're pregnant with twins, they're automatically going to ask you, hey, well, we're going to do a scheduled C-section at about 38 weeks, so pick a day. Or if your baby is breech, hey, we are going to probably just do a C-section instead of allowing you to push. And well, you've been taking up a hospital room for 3 days now. And really, most hospitals don't even allow you to take up a room for more than like 8 hours before they're pushing for a C-section. This trend is partly due to a profession-wide loss of skill and confidence. When doctors aren't accustomed to delivering vaginally in all but the easiest situations, the C-section cycle perpetuates itself. Studies have shown that when a first-time mother uses an epidural, her chances of needing a C-section increase drastically. Again, I did this essay by doing a lot of research online. I have a lot of sources. I looked at a lot of studies. So this isn't stuff that I just made up. Let's see, where did I? Studies have, okay. While the C-section itself is relatively safe for the mother and the baby, it is still a major surgery that carries risks. So the C-section is normally not the most risky part. It's everything leading up to the C-section. So the recovery time for a C-section is typically 6 to 8 weeks as opposed to 2 to 4 weeks it takes to recover from a vaginal birth. Additionally, the hospital stay for a C-section is usually 2 to 4 days, while the stay for a vaginal delivery is 1 to 2 days. I can attest to that. I stayed in the hospital for 2 nights. A C-section also increases the risk of having difficulties with future pregnancies, primarily decreasing the chance of successfully having a vaginal birth. C-sections in first-time mothers often lead to repeat C-sections in future pregnancies. According to statistics, 91% of moms who deliver via C-section the first time end up having a C-section again rather than a VBAC, which is a vaginal birth after a cesarean. Now, I'm not here to I'm not here to put down women who want to have a VBAC. Like, you know what your body is capable of. If you want to attempt to have a VBAC, that's great. But there are risks involved with that, and that's why a lot of doctors advise against it. That's why a lot of doctors, if they're doing their job right, will tell you, well, you had a C-section the first time, you're gonna need to have a C-section every time after this. Once a woman has had her first C-section, she is at greater risk for future pregnancy complications, such as placental abnormalities and uterine rupture, which is when the uterus tears along the scar line from a previous C-section. In the case of a rupture, severe blood loss in the mother and/or brain damage or death of the baby may be the end result. The risk for placental problems continue to increase with every C-section a woman undergoes. For example, uterine scarring from a previous C-section leads to a much higher risk of placenta previa, which is when the placenta partially or entirely covers the cervix, and placenta accreta, which is when the placenta burrows into the uterine muscle rather than simply attaching to the lining. Both conditions can trigger life-threatening hemorrhages in the mother, either during labor or after giving birth. A French study also concluded that women are 3 times more likely to die during a C-section delivery than a vaginal birth, due mostly to blood clots, infections, and complications from anesthesia. Moms who experience induction of labor via Pitocin with an epidural are 6 times more likely to have a C-section than those who don't have either intervention. Let me check on him real fast. He's literally just right inside, so I promise I'm not a neglectful parent. Yeah, there he is, just eating away. He's eating mangoes, so yeah. I will continue my spiel. Okay. C-sections not only pose a risk to the mother, but the baby as well. If the baby's gestational age was not calculated correctly, a baby delivered via C-section could be delivered too early, resulting in a low birth weight and more time in the NICU. Low APGAR scores have also been linked to the anesthesia used during the procedure. Babies present and future delivered via C-section are also at greater risk for a stillbirth due to the distress before delivery or the lack of stimulation during delivery. During a vaginal delivery, the muscles involved in the process are more likely to squeeze out the fluid found in the newborn's lungs, which is beneficial because it makes babies less likely to suffer breathing problems at birth and during childhood, such as asthma. Babies born vaginally also receive an early dose of good bacteria as they travel through the mother's birth canal, which can help boost their immune system and protect their intestinal tracts. According to a review study, additionally, a review study has found that women who have had a C-section are less likely to begin early breastfeeding than women who have had a vaginal birth due to the lack of oxytocin activated during a C-section. So, oxytocin you don't experience oxytocin during a C-section. And oxytocin is necessary to basically get your milk to start. A lot of people are under the impression that your milk does start to develop early on in pregnancy. Your milk ducts, but your mature milk doesn't come in until about 3 to 5 days after delivery. What comes out before that is colostrum. So, C-sections, I tried really hard to avoid a C-section. So, yeah. Oxytocin is the hormone released by the pituitary gland that regulates social interaction and sexual reproduction, playing a role in behaviors from empathy, generosity, and orgasm. Makes you feel good. When we hug or kiss a loved one, oxytocin levels increase. Hence, oxytocin is often called the love hormone. This hormone plays a huge role in all pair bonding and is greatly stimulated during sex, birth, and breastfeeding. Because an epidural blocks the release of oxytocin, breastfeeding becomes substantially difficult. Not only does the release of breast milk become delayed, but the baby may have trouble latching on due to the delay or even depression of his or her rooting and sucking reflex. Some studies have speculated that there may be a localized effect of epidural anesthesia that dulls the sensation of the baby's soft palate, which is critical for a proper latch and suck. The mom might even end up delaying the first nursing session out of fatigue because she doesn't get the same rush of adrenaline and oxytocin that a woman birthing her baby naturally experiences. Oxytocin can put a mom in an otherworldly state during birth, so a euphoric state. It allows her to relax and get tuned into her own body. An epidural interferes with oxytocin, so women are not able to enter this primal birthplace and are more aware of pain and can be more fearful. Not only does oxytocin stimulate the ejection of milk into the ducts of the breast, but it also increases contractions of the uterus during labor. As mentioned previously, an epidural numbs the pelvic muscles and the vagina, resulting in the failure of the brain to release oxytocin to get the baby out. Without this surge of oxytocin to help the uterus contract, the need for Pitocin is always guaranteed, as labor tends to slow down and contractions become weaker. Pitocin Pitocin is the synthetic version of oxytocin that is not regulated by the mom's body or the baby, resulting in intense and frequent contractions that don't allow the mom or baby time to rest. Without adequate rest between contractions, the baby might not get enough oxygen and become distressed, resulting in an emergency C-section. Pitocin induces contractions, but those contractions aren't going to actually do anything unless the cervix is ready, and the Pitocin will not change the cervix. It will not dilate the cervix. The need for an epidural increases since Pitocin creates more intense contractions and interferes with the body's natural production of endorphins, some acting like morphine helpers to offset the pain of birth naturally. As mentioned previously, the stages of labor should naturally come in waves. So if you look at what a contraction looks like, it literally is a wave, and then it does this, and then it drops off. So the stages of labor should naturally come in waves, which allow the mother to experience the pain gradually instead of all at once. During a natural birth, a woman's body will slowly release the appropriate amounts of oxytocin and endorphins according to the current stage of labor. So your body is actually pretty smart. It knows what it's doing. You should stop underestimating your body. This allows a mother to cope with the pain in a more natural way and on her own, which is true, for me at least. When administered Pitocin, the mom doesn't ride the wave of labor and instead experiences more intense pain all at once, resulting in the administration of an epidural. Unfortunately, epidurals numb the uterus and keep the brain from telling it to contract, which oftentimes results in stronger or multiple doses of Pitocin, increasing the need for additional epidurals. Like epidural, and especially in the combination of one, Pitocin can cause ruptures of the uterus, fetal distress, drop in the fetal heart rate, and fetal demise due to the overstimulation of the uterus. According to many women who have experienced both a natural birth and a medicated birth, the medicated birth was more painful, and she felt a more satisfying experience with the natural birth. In conclusion, there are many risks associated with the administration of the epidural. In addition to what was previously discussed, an epidural can cause a drop in blood pressure, resulting in IV fluids, additional medication, and oxygen. The fetal heart rate will need to be continuously monitored in preparation for the increased fetal distress possibility. If labor continues for more than a few hours, the mom might require urinary catheterization, since urinating will become more difficult due to abdominal numbness, and also because you can't stand up to go to the bathroom. Permanent nerve damage may occur in the case of accidental puncture of the spinal cord coverings. In severe cases, some women become partially or fully paralyzed from the waist down. Leakage of spinal fluid might occur, which can result in severe spinal headaches or migraines that last for a few days or a few months after. I actually know people personally who experience this and can attest to this and say, yes, after having my baby, I have had really bad migraines. Let's see. The mom may even develop pelvic floor problems such as loss of anal and or sexual stimulation, painful anal sexual stimulation, and urinary incontinence, and uterine and or bladder prolapse, meaning your uterus or your bladder falls out of your body. Epidurals have also been known to cause complications from infections and epidural abscesses, shivering, ringing of the ears, backaches, soreness where the needle was inserted, nausea and vomiting. According to a study, 19% of epidural users developed a fever, while only 2.4% of non-epidural users did. This results in the baby to be 2 to 6 times more likely to be weak, require resuscitation, have seizures during the newborn period, and have poor muscle tone, and have low APGAR scores. You can look up what APGAR score means. I didn't add it in here, but it is important. They do that with every baby that's born. The higher the maternal fever, the higher the risk of the baby. Additionally, the baby is also at risk for sepsis, reduced to immune system function, and difficulty transitioning after birth, leading to more time in an incubator or the NICU. 95%, and this is a direct quote from a source, so 95% of low-risk women could give birth without medical intervention, but only 1/4 of those women want to. Only 2% actually do this. This needs to change. My resources were HuffPost, Fit Pregnancy, American Pregnancy Association, obviously WebMD, Mama Natural, Healthline, UT Southwestern Medical Center, Baby Center, Live Science, Business of Being Born documentary, Psychology Today, and Affording Motherhood. Now, I recommend highly that you see the business of being born is a must when you're pregnant. You need to understand how America differs from other countries in the birthing process, and you will be appalled at the things that they do. It goes over all of this. I mean, it tells you what I just told you, basically, but it also goes more in depth with how America used to handle childbirth, which is it's disturbing. And also they go into, they basically, because it's a huge, like the pharmaceutical company, a lot of women are not allowed to birth for as long as they need to. A lot of hospitals have time limits that a person can occupy a room. And if you start exceeding that time limit, they're going to want things to hurry up, which means they're going to put Pitocin in your line. They're going to want things to speed up. And eventually they're going to tell you, hey, you just need to get a C-section. Because they're trying to flip those rooms and get more patients in and out of there to make money. If you've ever waited tables, this should make sense to you. You're trying to get the customers in and out of your sections so you can get more customers in and make more money. So I hope that makes sense. So that was the final part of the essay that I wrote. This is going to be like a series of videos in regards to my birth plan. But this is part 2 of the first part of my birth plan. The second video, I will go over my actual birth plan. And then the third video, I will talk about what I put on my hospital bag list. So stay tuned and go ahead and move on to the next video.